Welcome to an exploration of the Access Nevada landing page. At first glance, you can either create an account if you are new to Access Nevada, or you may sign in if you already have an existing Access Nevada account. Before scrolling further down the page, you might notice that we have a button for SEBT. This is a seasonal button and might not be available for you depending on when you access the Access Nevada landing page. Scroll down the landing page and you can see some of the benefits and services that are available from Access Nevada. Let's take a few minutes to look at some of the offerings presented here. If you click on Addiction, you will be taken to a program page as seen here. This topic only has one program at this time. If you click on it, you will be sent to a page with more information. The Nevada Tobacco Quit Line is a free, confidential service that offers evidence-based cessation services, including coaching, advice, and nicotine therapy, to support Nevada residents who want to quit using commercial tobacco products. By selecting Check Now, you will be taken to an assessment and application. The next option we will look at is Disability and Senior Services. There are three options to explore in this section. Our first option is the Autism Treatment Assistance Program, ATAP. ATAP is a statewide program that provides temporary assistance and funding to pay for evidence-based treatment for children on the autism spectrum who are under the age of 20 and are diagnosed as a person with autism spectrum disorder by a physician, psychologist, child or adolescent psychiatrist, pediatric neurologist, or other qualified professional. The link at the bottom will provide more information. Our next option is the Office of Community Living Programs, OCL. The Home and Community-Based Services waiver programs authorize services to help individuals with physical disabilities and seniors to maintain independence in their own homes and communities as an alternative to long-term care facility placement. This page provides a link for additional information as well as a button that will allow you to apply for services. Our final option in this section is Developmental Services, DS. Developmental Services is a statewide program that provides services and support to eligible children and adults with a diagnosis of an intellectual disability or a closely related developmental disability occurring before the age of 22 years. This page also provides a link for additional information, as well as a button that will allow you to apply for services. Our next section is called Family Support. There is only one option in this section: Wraparound in Nevada, WIN. WIN is a statewide, community-based program that offers a tiered care coordination approach to serving children and youth with severe emotional disturbances and complex behavioral and mental health needs. This page provides a link for additional information. Our fourth section is Food and Cash. Our two sections here are cash assistance, called TANF, and food assistance, or SNAP. Our first option is Cash Assistance, or TANF. TANF is designed to provide temporary assistance for needy families to care for dependent children in their own homes or in the homes of relative caregivers. The link at the bottom of this page will provide more information, or you can apply for this program in Access Nevada. The second option is Food Assistance, or SNAP. SNAP is a federally funded program to help low-income families buy nutritious food from authorized retailers. At the bottom of this page is a link for more information on the Food Assistance Program, or you can click the Apply Now to submit an application for assistance. Our next section for discussion is Healthcare. Our sections here include Medical Assistance, Women's Health Connection, and information on rural clinics. Our first option is Medical Assistance. The Medicaid program is a federal program administered by the state. Its purpose is to help meet the cost of medical services for individuals receiving public assistance payments and individuals and families with low income. At the bottom of this screen is a link for more information and a button to apply for assistance. The second option is the Women's Health Connection. The Women's Health Connection is a breast and cervical cancer early detection program dedicated to serving low-income, high-risk, uninsured, and underinsured women living in Nevada. At the bottom of the page is a link to more information and a button that will provide an assessment to see if you qualify. Our final option under the Healthcare section is about rural clinics. Rural Clinics is a state agency within the Nevada Department of Health and Human Services, Division of Public and Behavioral Health. Rural Clinics screens all person requesting services to ensure timely access to needed services. At the bottom of this page is a link for more information, as well as a PDF flyer about the rural clinics. Our next section is about programs for infants and children. Our sections here include child care assistance, the Nevada Home Visiting Program, the Autism Treatment Assistance Program, Nevada Early Intervention Services, and the Women, Infants, and Children Program. Our first option is child care assistance. The child care program assists low-income families receiving temporary public assistance, and those transitioning from public assistance in obtaining child care so they can work. At the bottom of this page is a link that will expand on what child care assistance is, as well as a button in which you can apply for the program. The second option is the Nevada Home Visiting Program. Home visiting is a service offered to support positive parenting, develop nurturing homes, and promote healthy child development through regular home visits by trained professionals. Families who are expecting or have children up to age 5 may voluntarily request these free in-home services. At the bottom of the page is a link with more information and a button leading to an assessment to see if you qualify for this program. Our next option under the Infants and Children section is the Autism Treatment Assistance Program. This program can also be found and was discussed in the Disability and Senior Services section. This page includes a link for more information about the Autism Treatment Assistance Program and a button leading to an application for referral. Our fourth option in this section is Nevada Early Intervention Services, NEIS. The Nevada Early Intervention Services, NEIS, provides comprehensive, individualized services to families with eligible children, birth to age 3, who have a diagnosed disability or developmental delay, at no cost to the family, in the child's natural environment, such as the child's home and/or community settings. At the bottom of this page is a link for more information on early intervention programs and a button to apply for a referral for this program. The final option in the Infants and Children section is the Women, Infants, and Children Program, WIC. WIC is the USDA Special Supplemental Nutrition Program for women, infants, and children, and provides nutrition and breastfeeding support and referrals to other public health programs. At the bottom of this page is a link for more information and a button that will help you through the referral process. Contact DPBH for program-specific questions or status of existing applications. Let's take a look at mental health next. The mental health section has a number of offerings available to view. The first option on this list is Care Team. Rural Clinic's immediate mental health care team supports adults anywhere in rural Nevada who need immediate mental health care. Please contact DPBH for program-specific questions or the status of existing applications. At the bottom, there is a link for a flyer that has more information. Our next option is the Children's Mobile Crisis Response Team. The Mobile Crisis Response Team provides crisis intervention and stabilization services for youth and families of youth under the age of 18 who are exhibiting behavioral or mental health concerns in which the behavior requires urgent intervention. Contact DPBH for program-specific questions or the status of existing applications. At the bottom of the page is a link for a flyer with more information. Our next option is Southern Nevada Adult Mental Health Services, or SNAMS. SNAMS provides inpatient services, mobile crisis, outpatient counseling, service coordination, case management, medication management, consumer assistance program, or peer support program, residential support programs, mental health court, programs for assertive community treatment teams, assistant outpatient treatment, and drop-in center. This page includes a link and a flyer for more information about Southern Nevada Adult Mental Health Services. Please contact DPBH for program-specific questions or for the status of existing applications. The first option in the right-hand column is the UNLV First Episode Psychosis, FEP program. The FEP program was modeled after the successful Evidence-Based Navigate program and is a comprehensive program providing early and effective treatment to individuals who have experienced a first episode of psychosis. Contact DPBH for program-specific questions or status of existing applications. At the bottom of this page is a link for more information. The next option we will look at is the Nevada Recovery Program. The Nevada Recovery Program works with various agencies to help convicted felons from risk of backsliding by providing skills and the support they need in order to be a productive member of society, along with sustainable outcomes for themselves and their family. Contact DPBH for program-specific questions or status of existing applications. There is also a flyer linked at the bottom that provides more information. Before scrolling down in the mental health section, we will look at the Northern Nevada Adult Mental Health Services, NAMS. NAMS provides inpatient services, outpatient counseling, service coordination, case management, medication management, consumer assistance program or peer support program, residential support programs, mental health court, assisted outpatient treatment, and drop-in center. There is a link at the bottom of the page and a flyer that has more information. Contact DPBH for program-specific questions or status of existing applications. If you scroll down in the mental health section, you will see even more programs. Our next option for review is the Performance Optimization for Wellness Empowerment and Resilience, POWER, University of Nevada, Las Vegas, UNLV practice. POWER is a strength-based interdisciplinary program providing treatment, support, and empowerment to individuals with early bipolar and their family members to optimize functioning across relationships, health, education, employment, and other important life domains. At the bottom, there is a link for more information. Contact DPBH for program-specific questions or status of existing applications. Our next option is the Support Outreach Access and Resilience, SOAR, at the University of Nevada, Reno, School of Medicine. The University Health SOAR program is to provide early intervention for psychosis while educating our Nevada communities. Our services are intended to be youth-friendly, age-appropriate, sensitive to culture, gender, and the social stigma of psychosis. Contact DPBH for program-specific questions or the status of existing applications. At the bottom of the page is a link with more information. At the bottom of the left column is our next topic, Wraparound in Nevada. Wraparound in Nevada for Children and Families is a statewide community-based program that offers a tiered care coordination approach to serving children and youth with severe emotional disturbances and complex behavioral and mental health needs. At the bottom of this page is a link for more information and a button to apply for the program. Our next option to explore is the Collaborative Healthcare Advancing Resilience Growth Empowerment to Unlock Potential, Charge Up, at the University of Nevada, Las Vegas. Charge Up is a strengths-based outpatient treatment program designed for young individuals who are at high risk for developing psychosis. There is a link at the bottom of the page with more information. The last option for the mental health topic is the Carson Tahoe Behavioral Health First Episode Psychosis, FEP, program. Through a community mental health block grant, Behavioral Health Services was awarded $500,000 for a first episode psychosis, FEP, program. Psychosis involves loss of contact with reality, such as hallucinations or delusions, lack of self-care, and difficulty thinking clearly. Contact DPBH for program-specific questions or the status of existing applications. There is also a link at the bottom that provides more information. The next section we will explore is the Nevada Office of HIV. As you can see, this section has two topics to explore. The first one we will look at is the Ryan White Program. The Ryan White HIV/AIDS program is the largest federally funded care and treatment service program for people living with HIV. The program was named after young Ryan White, who was diagnosed with AIDS in December of 1984 after receiving a blood transfusion. At the bottom of this page are two links with more information, as well as an assessment to see if you or a family member qualify. Contact DPBH for program-specific questions or status of existing applications. Our next topic is HIV testing. The only way to know for sure whether you have HIV is to get tested. The CDC recommends that everyone between the ages of 13 and 64 get tested for HIV at least once as part of routine healthcare. Contact DPBH for program-specific questions or status of existing applications. There is also a link at the bottom of this page with more information. If we scroll down a little bit more and select View More, you will notice that there is another topic to explore. Let's take a look at victim assistance. As you can see here, there are two programs within the victim assistance topic. The first option we will look at is the Confidential Address Program, CAP. The Nevada Confidential Address Program is a program that helps victims of domestic violence, sexual assault, human trafficking, and/or stalking from being located by the perpetrator through public records. At the bottom, there is a link for more information. Contact DCFS for program-specific questions or status of existing applications. Our next option is the Victims of Crime Program, VOC. The VOCP goal is to assist eligible victims of crime and their families cope and recover from the physical, emotional, and financial impact of violent crime. Contact DCFS for program-specific questions or the status of existing applications. At the bottom of the page is a link with more information, as well as a button that will lead to an assessment to see if you qualify for assistance. Now that we have looked at all of the topics currently offered on the landing page, let's scroll down once more to see the last section on the landing page. The bottom of the landing page has an announcements section. As you can see here, at the moment there are no announcements available. However, as new programs begin, or if additions to current programs become available, you can learn about them first here. Take the time to maximize your social services by exploring and educating yourself about the many programs that Access Nevada has to offer. Thank you for viewing the Access Nevada landing page video.